Let's talk about these tight inner thigh muscles. So what if you go to do this old butterfly pose or whatever you want to call it stretch? Remember from like high school track where they're like, all right, put your feet together, let your knees come out. And you would feel extremely tight. There was always that person whose knees were stuck up here and they couldn't go down. Now, what are the effects on your body of having adductors that are this tight? And that's a couple things to look at. So one of those effects is your adductors attached to your pubic bone. Okay, when our pubic bone gets pulled down, so it has something pulling on it, that can pull us into an anterior tilt. All right, an anterior tilt shuts off our abs, tightens our paraspinals in our back, lengthens our hamstrings, which give us stability, makes our glutes less available to want to do good glute squeezing things. So those tight adductors can affect our pelvic positioning. The other thing they can affect is our pelvic floor. So our adductors share a lot of fascia in with the pelvic floor. So it's like kind of like think about it as a fascial continuation. Right, so those adductors come in, attach it in that pubic bone, but then our pelvic floor is like right there. And so with that fascial attachment also comes lots of encouragement for firing. So I've often found that tight adductors can go hand in hand with tight pelvic floor muscles, and tight pelvic floor muscles affect pelvic floor function, which can then lead to things like leaking and prolapse and all that good stuff. Okay, so if you want to do a quick test for adductors, what I want you to do is check the difference so you can see between an anterior pelvic tilt and a posterior pelvic tilt. So I want you to press your low back flat on the ground and let your legs hang open. So you can see here I'm in a posterior pelvic tilt, and this is the range I get. Now, if I go into an anterior pelvic tilt, so let your back come up off the ground, do you see how much more easily my knees open? So this is telling me that my adductors are a little tight, and you can see how much this tightness for adduction pulls me into an anterior pelvic tilt if I did indeed need to get my knees open, okay? So my adductor length right there is plenty normal and plenty long enough, okay? So I think sometimes we tend to think that a muscle needs to be really, really long. So I have a lot of people that will say, oh, my hamstrings are tight, they're affecting my function. And I'm like, yeah, your hamstrings really aren't tight enough to affect your function, okay? But there does become a problem where if you feel like you're trying to stand with a more neutral pelvis and not spilling forward in that big anterior tilt, and you feel that pulling in your adductors, like, okay, my adductors, you feel resistance, essentially. So if you feel resistance for finding that nice pelvic neutral, then that could be part of the problem. So if you go to do that test and you go into a posterior pelvic tilt, so you tuck your bottom under, and your knees are stuck way up here, that might be a big sign that you probably need to work on lengthening your adductors. All right, so the other question I want you to ask yourself, other than do I need to lengthen my adductors, is why the heck did my adductors get tight to begin with? Okay, so if you just have tight adductors and you've had them your whole life, and you also have tight hamstrings and glutes and shoulders and everything is tight, then you just might have a genetic predisposition to tightness. But if you feel like your tight adductors are something that has kind of come on in the last few years and it's really become an issue, what we need to ask yourself is, why are the adductors overworking? Because in my book, if there's a tight muscle, that tells me there is an overworked muscle. Muscles just don't tighten up for no reason, right? They have a reason. And usually it's because we're asking them to work too much. So what we want to look at is, how good is your glute strength? Do you have amazing glute strength? Because your glutes are going to help stabilize your pelvis from the back, specifically your glute medius from the side. So if we think about the leg, we've got our adductor working on one side, we've got our glute medius working on the other. So think about that as like this really great stability system that happens. If we don't have a great glute medius out here, the poor adductor is going to run that show because it's got to pick up all that slack. So you really need to have balanced glutes to help adductors. What's the other thing we need? Great abdominals. So remember how I was talking about the adductors coming in and attaching into our pubic bone? Well, if our adductors are attaching into our pubic bone, what else is coming down and attaching into our pubic bone? You got it. We've got all these adductor muscles, especially these lower abs, that are also working with the pelvic floor. And so we need great abdominals and really good pelvic floor muscles to help our adductors let go. Okay, so oftentimes tightness with the pelvic floor comes along with weakness, and then once we get rid of the tightness first, then work on strengthening, it can help that let go. So addressing core strength, addressing breathing, addressing glute strength, and then some eccentric loading of these adductors is exactly what it will take to get these guys to let go. So if you just do a bunch of passive stretching, what are you changing? Nothing. You're just lengthening a muscle. You're just kind of pulling on a muscle, but you're not giving anyone else the job. You're not teaching the muscle that it's safe. Basically, you're just passively lengthening the muscle, which sometimes is needed, okay, especially if you've lost some sarcomeres and the muscle is really, truly functionally shorter. But most of the cases that I see, you really just need to get other muscles to come in, pick up the slack, do the job so that the muscle that's being overworked can actually just let go. And then as soon as this happens, as soon as you get a little bit more balanced strength, the muscle in question lets go, everybody's happy, no stretching is even needed, which is pretty darn cool. So hopefully this will help you with a little bit of investigation into adductor tightness, or quite possibly pelvic floor tightness, or your anterior tilt that just doesn't seem to want to go away.